League Women Voters. March already, March 11th. Just want to point out a few things before we get started. Please tell Mary Schick I did bring my water bottle with the Be a Voter sticker on it. He's currently in Washington, D.C. meeting with Representative Hovagimian, so that's pretty exciting. We're anxious to hear what she has to say when she comes back. Also, you will notice on the some of the tables and at the front, the league aprons. We are selling those to our members for $27, and then we'll have them at the convention for an increased price. I took them to council last year, and they went bam bam right away. So we think that they'll be a popular item, and I use mine a lot. They're really nice quality, so we're very happy with that. And also on most of the tables, there's a printout of some land use and comprehensive plan information that Jackie did up for us. She's going to talk about it a little bit later. So that's so you can have all those resources at your fingertips. All right, Meg, if you would lead us in the land acknowledgement.
Can you guys hear okay?
Yes. Yeah,
We
very good.
collectively acknowledge this gathering is being held on the stolen and unceded ancestral and contemporary lands of the Chinookan people and the Cowlitz Indian tribe. We pay our respect and gratitude to the indigenous peoples of this land, past, present, and future. With this acknowledgement, we commit ourselves to continued education, accountability, and social justice.
Thank you, Meg. Very pleased to introduce Alan Unell and Voki. You know, I have it on my roster phonetically, and I can zip through it when I'm looking at it. So I apologize, Voki. We are pleased to have you back with us in person. They've been very active with following the ups and downs of healthcare for our citizens nationally and in the state of Washington. And the focus today is on reproductive health care in the state of Washington and nationally. And to show you how on top of things they are, within the last, I don't even think it's been 24 hours, we've gotten 3 updates to their presentation as they follow our legislature. So greatly appreciate what they're going to have to share with us, and I will turn it over to Alan.
Thanks, Nancy. It's a pleasure to be back here in public. Am I holding it up? Can you hear me okay? I can actually do it without the mic, but online they won't hear it. So, reproductive health care and overview, Alan Unell and Voki Hovagimian. Let's go next. So here's the agenda. We're going to do this in about 30 minutes. Reproductive health care. What is it nationally? What is it in Washington State? We have a bunch of references, and then we'll talk about legislation. The reason we were putting out, next, please. The reason we were putting out updates is that the legislature stopped by law. They have to stop at midnight yesterday. And so the latest update showed up at 6 in the morning. Okay, go ahead, next. What is reproductive health care? According to the Center for Disease Control, it includes contraception, birth control methods, long-acting reversibles, emergency contraception, that's usually pills, birth control education and counseling, exams, physical exams for reproductive health, breast and cervical cancer screening, testing and treatment for STIs, HIV testing, health promotion, disease prevention, information, which is education, pregnancy termination by 3 techniques, medication, aspiration, and D&E, pregnancy and maternity testing, comprehensive option counseling, referring, preconception health counseling, infertility counseling, and education, prenatal care. You see this goes on and on. Infant care, breastfeeding, clinics that deal with abortion, only half of their work is pregnancy termination. Everything else here is the rest. Go ahead. Okay, nationally, how is it looking? So after 50 years, the Supreme Court took away a woman's federal right to have an abortion and allowed individual states to decide whether an abortion is legal in each state. The rationale was that that right is not specifically called out in the Constitution. That should make everybody in this room uber nervous. Abortion is legal in 39 states with restrictions. Everybody has restrictions, and it is illegal in 11 states. Notice that if there's a federal ban on abortion, then the state laws are superseded and the federal ban would take effect. There is a lawsuit in federal court. It's in Amarillo, Texas, regarding the safety of mifepristone. You guys know what that is? That's the first acute drug used for pregnancy termination. It is actually safer than either Tylenol or penicillin. The claim that's in that court case is that several women have died. I got to tell you that the statistics show that the only people that die from abortions in the US die in surgery, and the number is in the single digits, out of close to 900,000. So it's inordinately safe, and nobody dies from the medication. Activities continue in a lot of states in how to proceed. That's positive and negative. Go ahead, next. So what kinds of abortion are there? You guys probably know there's mifepristone and misoprostol. That's suitable for generally up to 10, sometimes 12 weeks. It accounts for about 53% of all abortions. Vacuum aspiration is done up to 16 weeks, dilation and evacuation up to 24. 93% of all abortions occur in the first trimester, 6.2% are in 14 to 20 weeks, and 1% after 20. Now, this is really important. It's in little letters at the bottom. Don't confuse miscarriage, which is 10 to 20% of all pregnancies, with abortion. Miscarriages often require an abortion afterwards to clean up the womb to actually maintain the health of the mother and fertility. Okay, and that's actually quite a problem. If you don't do that, the mother risks death or lack of fertility. It is a horrible situation. Go ahead, next one. I put this up here because this showed up just about a year and a half ago in Brussels. The European Parliament voted in favor of a landmark report by the Croatian representative, Fred Mati, on sexual and reproductive health rights in the EU. And essentially, the report addresses the full range of sexual and reproductive health rights. It highlights the importance of accessing all essential services. The big deal is, in bold, that the European Congress recognized that in the 21st century, they will no longer treat women as second-class citizens. So in Europe, restricting reproductive rights is treating people as second-class citizens. Somehow people in the US don't say that, but that's what it is. Next. Having rights and exercising them, two very different things. 6 states have 1 abortion clinic left. 24 states impose unnecessary restrictions to make it really difficult to have an abortion. 46 allows some healthcare providers to refuse to provide services. 12 allows some healthcare providers to refuse to provide services related to contraception. How does that make you feel? That's horrible. I'll tell you a little bit more about that in a minute. 18 allows some healthcare providers to refuse to provide sterilization services. This one is a shocker because we looked online and federally there is no. Okay, so typically the policy is if you want more permanent contraception, like tubal ligation or something, they'll tell a woman to come in with a form signed by your husband. Does that make you feel good? No. There is no federal rule to do that, even if it's Medicaid involved. There's no, and they explicitly say it. However, individual facilities do it for whatever reason, and they say if you don't want to sign the form, you don't have to have the process done. Go away, and they get away with that. It is really important to pay attention to cybersecurity and reproductive health care. We're going to talk about that a little later. Part of the reason is that I can do it really quickly. Do you guys all know what HIPAA is? Yeah, okay. So HIPAA was set up in the 1980s and is to protect everybody's data. A medical facility can't sell your data without your consent. They can't give it to somebody else without your consent. However, what's happened is a lot of medical data now winds up in places that are not required to be HIPAA compliant. These are apps, these are software, these are websites. You got to be careful. You also have to be careful if you're browsing online for things related to abortion or reproductive health care, because such browsing and even telecommunication and text messages can be subpoenaed by authorities if your state has laws that allow them to do that, and they can be used actually in a court of law for conviction. This already happened in no, it was another place, Oklahoma. Sorry, Texas too. In Oklahoma, there was a mom and her daughter that were trading text messages about abortion because the girl needed an abortion, and the authorities got a hold of the text messages and they were convicted based on that. Okay, next one. Anyway, we have a bunch of recommendations for how to protect yourself. Facts about abortion. 25% of all women have abortions. 53% are medical in the first trimester. 10 to 20% of all pregnancies end in miscarriage. Generally, 70% of those are fetal defect. It's typically a chromosome failure, and the fetus won't survive. Miscarriages often require abortion to ensure the health of the mother. Most states that have legal abortion provide about 10% of their abortions to women from other states. I didn't know that. Washington is one of them. It turns out that Planned Parenthood picks up people from Idaho in the east, and Cedar River picks up a lot of people from Texas. 60% of all abortions are provided at clinics, 35% at non-specialized clinics, just health clinics, 3% in the hospital, and 1% in the physician's office. So when you see legislation proposed somewhere that says it's got to be somewhere in a hospital, not so. I mean, this is about as safe as it gets. Go ahead, next. The effect of limiting abortion. So depending on how the law is worded, miscarriages and ectopic pregnancies can become deadly. There's an example, I'll give you the example in a minute. There will be increases in maternal mortality. Maternal mortality measures how many women die either during pregnancy or in the first year after giving birth. It's 62% higher in 2020 in abortion restricted states than in abortion access states. That's horrible. So in states that restrict abortion, women die. It's just bad. The other fun fact, I don't know how to say it.
It's
Abortion
true,
is
it's
far
true.
safer than giving birth. It just is. More people die giving birth than having an abortion. When the law allows abortion in case of an emergency, not just for the health of the woman, physicians typically wait until near death to actually take the action. This is the case in Texas. So the way the laws are often written in many states is that you can have an abortion in the event of an emergency to save a woman's life. What they do when it says save a woman's life, they typically wait until it's critical. That is, their sepsis and she is near death. Frederica Wilson, who's a representative in Congress from Florida, she is not young. She is probably 10 years older than me. In the 60s, she was forced to carry a dead fetus for 2 months in Florida. Does this sound good? But this is the effect of these laws, right? She was forced to do it. And I got news for you. When she gave this lecture in Congress, this was in January of this year, she stood up and said, you got to fix this. Look at what it did to me. Another representative, another woman, I don't remember the state, I think it might have been Colorado, said, me too. I had to also hold on to a fetus when it wasn't necessary, and it risked my life. This is just horrible. Many states have, and some have proposed legislation, again, to wait till a woman is critical. I got news for you. In Washington, that they did that here too. legislation was put forward this year. It's called abortion safety. It is off the books now. I checked last night or this morning, it was gone. But it restricted who can perform an abortion, because in Washington, it can be a physician's assistant, nurse, practitioner, nurse, doctor, it's anybody who's trained to do it. And it said only physician, and it took out the language for the health of the mother and replaced it with in the event of an emergency.
Do you want to mention about the midwives?
I'm gonna get to that. I'm gonna get to that. Go ahead. Well, I guess I'll do it now. You guys have probably wondered, I don't know, it's in the package, but where does all this abortion law come from? It turns out in 1857, there was a doctor in the United States. His name was Horatio Storer. Horatio Storer was a doctor. He was Harvard-trained physician. And he was personally responsible for sending letters to every governor of every state demanding that abortion be made illegal. He had a lot of reasons for doing this. They were not good reasons. Abortion has been sort of a standard medical procedure going back a long ways. It's typically done with medicine or herbs. And he was concerned that there's just not a nice way to say this, is there?
Don't do it nice.
He was concerned that the people that were having abortions were typically white Protestant women. And he was concerned that there would be too many babies of color that would overtake the country. And so he did that. And he
That
was
one of the reasons. The second one was he wanted to keep the money, not the midwives, which were the ones that were doing the abortion mostly.
Yeah, actually abortions were done, more than half were done by Black women, and they wanted them not to be paid for any services regarding women. So together with the AMA, they sought to make midwifery illegal. That shows up around the late 1800s. It's just an ugly story. Anyway. So reproductive care in Washington state. Abortion, happily, remains legal and covered by healthcare insurance in Washington state. That includes Apple Care. It is guaranteed by the Reproductive Privacy Act of 1991, which was reaffirmed. They actually voted on again in 2022, just to make sure everybody's okay. Apple Health, which is Medicaid in Washington, offers comprehensive healthcare services for women who've had abortions and for those that have given birth for 12 months afterward, which is pretty good and more generous than most states. Go ahead. There's a comprehensive list of questions, frequently asked questions at that website, which is posted on the Department of Health website regarding family planning and reproductive care. The backup slides also have links to, do you want to click on, can you click on it?
You're just asking for trouble. Okay.
Does it show or no?
Yeah. Oh, no.
Doesn't.
It doesn't. Okay.
Okay, never mind.
That's because I didn't do screen share. I did presentation share.
That's okay. So let's go on to the next slide.
Hold on. I got to get back.
Okay. And while we're doing that,
All righty.
go to the next one, please. One of the important things to remember is in Washington, there's a right of privacy that goes with abortion. You have to fill out a form to do it, but you have a right of privacy, and this applies to minors as well. Children who don't want to tell their parents, you don't have to. Women who don't want to tell their husbands, you don't have to. You have to fill out a form. If there's insurance involved, it gets sent to them. The provider helps you with that. The Department of Health posts that form on their website. People can just download it, print it, and fill it out, and you're done. Okay, traveling to Washington, because this is a state that does have abortion. Planned Parenthood saw patient increases. They saw a 5% increase between April and August, and a 19% increase between August and October of 2022. almost all from Idaho, which has pretty much made abortion illegal. I will tell you, we also work with Unell or Pro-Choice Washington, and one of their leads told us that the University of Idaho has now made it extremely difficult, their healthcare services, to provide contraception. So people are winding up in trouble.
What's the state?
Do they? It's horrible. Cedar River clinics also saw an increase, mostly from patients in Texas, because somebody wrote a newspaper article in Texas and said Cedar River clinics in Washington, they offer abortion. So people from Texas came to them.
There's a significant number, or there was a significant number of donors from the Pacific Northwest who donated to an organization called Texas for Choice.
Mm-hmm.
And I've been a donor for, well, since the Texas law passed. However, in December, I got a letter from them stating they could no longer guarantee the security of my information, as the state of Texas has filed a suit to get access to all of their donor information, and they can sue anybody on that list.
Wow.
Okay,
That's
that's,
a new one for us.
of course, if you stay here, there's nothing they can do.
No, they can sue you wherever you are based on the Texas law.
So they sue you in a Texas court. If you don't go to Texas, it doesn't matter. They can't attach your assets if you're here. Okay, go on. So misinformation about abortion. So we decided to go to the National Institute of Health to get information. And despite myths and misinformation, there is no evidence that having an abortion affects fertility, prevents you from becoming pregnant in the future, raises the risk of breast cancer, miscarriage, or affects long-term mental health. However, after a miscarriage, make sure to contact your health provider because it's a safety issue. Sepsis is a real problem, and the womb has to be cleaned up to make sure that fertility is maintained. Post-miscarriage abortions help make sure that the uterus is healthy and the woman's life is spared and she is healthy. Go on, next one. Let's talk briefly about Washington legislation. There was a ton of legislation that came through this year. Most of it didn't survive. You guys may not know how Washington, maybe you know how Washington legislation works. We are currently in a long session. We have about 35 or 37 more days to go. Last night was the cutoff for bills to have passed their House of Origin and move on to the next House. However, this is a funding year. It's a biennial item, and we make a budget for 2 years. Since the budget is in work now, they get an extra 35 days to work on the budget. That's why we're longer. So some of the bills, this is one, HB 11. Oh, so what I was going to say, I apologize, was that bills that are currently listed as dead are not really dead. They can show up later, like next year. HB 1155, My Data, My Health. It protects health data from non-HIPAA actors. Remember we talked about that a minute ago. It is particularly nasty, not so much here in Vancouver, but up in Seattle, it's pretty ugly. Crisis pregnancy centers are not HIPAA. You guys know what a crisis pregnancy center is? They claim to help women with pregnancy, but what they want to make them do is keep the baby. They are not HIPAA. They'll take your information and they can actually use it against you. They sell the information or provide it to people who target the women and send text messages, send emails, they call them. It's not pleasant. Apps that people use for tracking menstrual periods. I got to tell you, we have people who send us emails about that saying, what the hell are they doing that? I can't answer that question, but those apps sell the data.
Yeah, I can answer that question in a way because I have a young daughter who, when a child starts, I know all of you probably know this, when they just start their menstruation cycle, it's just so hard to remember, or some of us are not very regular. So some of us are very absent-minded. So to be prepared for an emergency, you would like to track it, and they have a software right now which tracks it for, and young kids love those kind of stuff and get notifications and stuff like that.
They also use it, if you're using the rhythm method, it's a way of like stabilizing and saying like, this is when I'm least likely to be fertile.
Okay.
So they use it for that.
Okay, good answer. So anyway, these apps will sell women's data, and who's going to buy it? Who buys it are people that want to target them for not getting an abortion. And so they get lots of interesting text messages and phone calls. Geofencing is another odd technique where you can actually figure out where somebody is based on their phone. And if they're near an abortion clinic, you can be busy sending them emails and text messages and calling them saying, don't go there. That shows up in Seattle. So this law was supposed to stop that. It has been modified, so it does not quite have the teeth that it originally had, but it's, I gotta tell you, it's better than nothing. And it's better than what people have in the rest of the country. Abortion cost sharing, in bold are the bills that survive. The companion bill, they only run one through. So Senate Bill 5242 is abortion cost sharing. If maternal care is in your healthcare policy, abortion care has to be also in your healthcare policy, and it should be covered at no cost. I got to tell you, costs are not very significant, but if you don't have money, that should not be the obstacle. It addresses Providence's refusal to cover most abortions. I don't know if you guys are aware of this. The state has this requirement that they're supposed to cover abortion. Providence refuses. Wait, I'll do that. This legislation would force Providence to do it. In 1 minute, since Providence does not cover abortion in the state of Washington, the state of Washington will pay for your abortion if you have Providence insurance. Yeah. Question, wait.
Mine, will Peace Health, which is Catholic owned, do abortions?
No, they don't have to. 50% of the hospitals in the state of Washington are not required to do so. And legislation that would have, part of the problem is that religious hospitals, religious organizations have been purchasing hospitals over the last decade. And what they do is they actually stop providing services. What goes out are reproductive health care, obstetrics, those things just vanish. And Senator Hasagawa has put forth legislation for the last several years to actually force the state to, force the hospitals to provide information on what services the purchased hospital will offer and to make sure that they don't decimate services or denigrate services. That legislation did not pass. Yes.
Does that bill address the fact that none of the Catholic healthcare services provide abortion contraceptive coverage to their employees?
No, it did not. Also, huge gap, right? Okay. Next one, please. Senate Bill 5036. This is not quite abortion care, but it's telemedicine. What was going to happen was telemedicine was going to be unfunded. They were just not going to reimburse for telemedicine. So this is a lot of abortion discussion happens with doctors either over the phone or in a video conference. Get me a prescription, right? And so you want to make sure that everybody who's involved gets paid for doing their job. Sadly, in our IMHO, in our humble opinion, it should just be that way forever. You don't put an end date on it, but they put an end date of 1 more year. But it's, again, better than nothing. Here's an interesting one, the House Joint Resolution 4201 or Senate Joint Resolution 8202. This was actually written by Governor Inslee. And Good for him. It enshrines reproductive choice rights and privacy into the state constitution. The state shall not infringe upon. Okay. The House bill needs a public hearing, but it may make it, maybe. House Bill 1035 cannot preclude a healthcare provider for providing care in the event of pregnancy complication, is dead. That bill just didn't make it. House Bill 1340 prevents the punishment of a provider for violating abortion laws in another state by practicing in Washington. So if one of the abortion providers, doctors, nurses, whoever, does an abortion, just like you were saying in Texas, suppose they do it on a woman from Texas, they can sue in Texas. This is not sue. This is, what is the right word? No, it's not prosecute. What they'll do is, if I'm a doctor in Washington, but I have privileges and I have a license in Texas, what they'll do is they'll suspend my license in Texas. Washington State has cooperative licensing agreements for doctors, states all over. What would happen is if my license were suspended in Texas, Washington would then suspend my license. And so this precludes that. You get to keep your license because you followed the law in Washington.
Do you want to do the shield law at this point?
I think I have it in
Next one.
next slide. Oh, wait, go back.
We're not ready yet.
13, yeah, okay. So that one looks positive.
You're listening to my.
I'm sorry, I'm not good with this. Thank you. Next. This one showed up just last night, HB 1469. It's called the Shield Law for Abortion and Gender Affirming Care. It protects providers from out-of-state subpoenas. And this one passed in the House and is now in the Senate Health Committee. I recommend you check the League of Women Voters website. Check the League of Women Voters website. The Advocacy Committee, Healthcare Advocacy Committee, has a list of all the bills that the League is supporting. You should go there. This is the time. Go there. Tell your representatives, here are the ones I support. Okay, next. So here are resources that we put in. The Department of Health page on abortion. If you know somebody who needs an abortion and they're in a state where they can't get medicine, aidaccess.org will provide it. That's a Dutch website. They'll hook you up with a pharmacist, with a doctor. The doctor will prescribe, and the prescription shows up in an unmarked package from India. Locating an abortion provider, abortionfinder.org is a safe place to use and is recommended by the state of Washington. Bedsider.org has tons of information on all kinds of reproductive health issues. For reproductive cybersecurity issues, there's a host, that's actually an article that Voki and I wrote, the Substack one, on cybersecurity. It has tons of recommendations. Go ahead, next one. Go ahead.
Oh, that's the history.
The abortion law history. Yeah, we did that already. The rest is backup material. There's a lot. That's the privacy law for abortion in the state of Washington. And these are actually just direct cutouts from, just stop there for a minute, direct cutouts from the state of Washington page. I got in touch with them, with the state of Washington, and I said, you guys fund 87 sexual health, reproductive health clinics. The state does. Which ones do in-process, do in-clinic abortions? I can't figure it out from the website. They said, no problem. Here, we'll send you the link. So it's an embedded spreadsheet and it has the link of each clinic, where they are and what they do. Well, they're nice. They answered the mail.
Tell them it's only 8 of them that really.
No, it's more than, it's 35.
It's 35.
35, yeah, 30, the state funds 35 clinics that will do abortions out of 87. The other 87 will provide medicine, right? And whatever, and all the other things that reproductive care facilities do. Okay, next one. All of those are links. There's Bedsider, Cedar Rivers. Legal Voice has really good questions and answers. The National Abortion Federation they do something really good. If you can't afford an abortion, you let them know, and your doctor. And what they'll do is, if you're really in need, they can try and come up with a grant that they just pay you about. So that's nice. And then the state has a pregnancy options workbook. Go ahead. And I don't know if we have to go through them. Go ahead. I think we're about done.
You are done.
I am done. This is all backup material. I'm done.
Okay.
For the universal healthcare one.
Well, okay, so there are two things. I'll do it quickly. So a lot of these issues would go away with universal health care. So the League of Women Voters affirmed, are you guys aware of this? The convention last year. They reaffirmed in a stronger way their 1991 decision to support universal health care. A lot of these problems go away with universal health care. Sitting in here, there's another, I'll do it 10:30. Minutes.
And we have a question. Are we going to start a question and
Yeah,
answer
we will in a
soon?
minute. So one of the things I want you to really take away is that a lot of the anti-abortion legislation treats women not as full citizens. You are not competent to make a medical decision about your own body. That's what it's called medically, is not competent. Okay, that is a second-class citizen position. It's important to fight against it, and it is hard to do when everything is at the state level. So what Voki and I recommend is contacting senators and representatives and say, restore rights at the federal level. That's really the way it has to go. For us. One more issue I'll tell you real quickly is that we do publish a daily action newsletter on healthcare and problems in healthcare, and it is pro-universal care. If you are interested, let us have your email and we'll send it to you. But every day there's something you can do to actually help push healthcare forward, and that's what we provide. So, questions? Yes, ma'am.
So if we could have a class.
Wait, I'm clearly again. Were you reading the stuff we wrote Thursday and Friday?
No.
Oh, because that's what we said Thursday and Friday was, no, we sent a note off to our subscribers and to Congress, say, we need to fix women's rights. You need to make, and I copied Jay Inslee's thing and I sent it here. The state shall not infringe on contraception nor on the right to choose or refuse abortion. It's not your business. And while we're there, don't extend the ERA deadline, remove the ERA deadline, because it is the only amendment to the Constitution of the United States that ever had a deadline. Absolutely. And while you're there, Pramila Jayapal is going to reintroduce universal health care, I think either this month or next. Yes, more questions.
Just a point of irritation.
Yes, ma'am.
In 2016, there was a federal constitutional amendment that was finally ratified after 102 years. So it's an point of irritation that they put such a short limit on the ERA. You can thank Phyllis Schlafly in part.
So what does this make you think about the way legislators treat women? I don't know what to tell you, but it is an offensive. Look, I've got a wife and a daughter. It is offensive to do that.
So we have a question.
Question online?
Question online from Zoom. Tracy.
Hey, Tracy.
Alan, thank you for an excellent presentation. And I do have one comment that I would like to make. And I actually have two comments I'd like to make. If presenters could repeat the questions from the audience, those of us at home would be able to hear them more clearly. But here is what my comment is. My comment is that I'm not sure if you know exactly how common miscarriage is. And 20% of all pregnancies end in miscarriage. I myself have had 3 of them. So I would like to caution you at saying that miscarriage often, the characterization I heard from you is that there is problems often. You use the word often, and you talked about certainly importance of seeing a healthcare provider, but not because the body doesn't evacuate after the miscarriage. So sometimes it doesn't, but not most. Most would be a mischaracterization. So thanks.
Okay, thank you. I think it's still a good idea to see a doctor. Oh, what she said is that she feels that most miscarriages, say it one more time, most miscarriages
Yeah,
do not require evacuation.
Yes, most miscarriages do not require evacuation. I didn't say that you shouldn't see a healthcare provider. I should,
Right.
but I just don't want to have people have a concept that miscarriage is, a miscarriage is common. That's all I want to say is, you know, it's terrible and it's emotional, is wrenching. But there's a wide bell curve of miscarriage, and let's not necessarily think that problem of evacuation in almost the emergency way that you suggested is often, and you had used the word often. So that's the word that I would just say would not be as.
Okay, thank you.
Could you summarize what she said?
What she said is that her understanding is that evacuation after miscarriage is not often, but is sometimes required. But you should see a physician anyway. Let me finish up with one quick thing about the law in Texas, because there's another lawsuit in Texas brought by a woman who's an attorney who suffered through sepsis, and is still suffering the effects of sepsis. It is women, you know, abortion is pretty much illegal in Texas. What they've done is they've brought together 5 women, and they're willing to take more, who have individual stories about different kinds of complicated pregnancies that the law doesn't address very well. She, in particular, had a pregnancy that was not viable, and she was allowed to suffer into sepsis instead of having the fetus removed. So that's one. Another one was a woman who needed an abortion because she had twins who were not going to survive. They would be both born dead. But if you aborted one, you could save the other. Did anybody think of this when they created these laws? The answer is no. So she suffered with that one. And there were some others that were difficult. Anyway, that lawsuit is ongoing. Yes, ma'am.
She must think that a woman's body can shut it all down if you're raped. So what do they know? They
Right,
don't care. That isn't what these laws are about.
right.
To your point, they are about putting women under men's control and not necessarily who you're married to, but specifically men. They can't hear you.
So the comment was that this is about controlling women,
Yeah.
generally by men who, not your husband or boyfriend. This is other people who want to treat women as second-class citizens and control their bodies. And it is, you're exactly right.
Yeah.
Okay, yes, sir.
Real loud, Bill.
Okay, this is just speculation on my,
Yes, sir.
but I'm wondering where all the money is coming from to drive the pro-life agenda.
So here's the question: is where does the money come from for the pro-life agenda? First, it's not really pro-life because it increases maternal mortality. So that's not a good thing. I don't have an answer for you. I can guess.
Please do.
A lot of it comes from religious organizations who have taken the tack that the life of the fetus is more important than the life of the mother. And it's actually a cultural shift because for several thousand years, the life of the mother superseded everything. Yeah.
I want to offer my own.
In your humble opinion,
I think there is a part of this that is about keeping a large but uneducated and stressed workforce. That they see our population declining in certain areas, and they want to drive, making sure they have plenty of bodies that are desperate for work, undereducated, maybe didn't have a very good home life, all the things that would drive somebody to take jobs that a lot of people wouldn't want.
So the idea was that it might be
Not the money.
people who want a
About
large
cheap.
uneducated one. Well, maybe, yes.
In July, I believe it's July, the Texas Federation of Jewish.
So I think within July, the Texas or the Florida Federation of Jewish Congregations sued the state of Florida because they're stating that their moral profile was different in the state of Florida, and the state of Florida was violating their precept that the woman's right to life superseded the infant's. Do you know what the status of that lawsuit is?
No, I don't know the status. That's a correct characterization. It is worth noting that a lot of states, I didn't include it in here, are actually seeking to apply the 14th Amendment to a fetus, and that's that would make any harm to the fetus murder. That it would make it homicide. In fact, there are 4 states that in the last, if you read the newsletter we put out, there are 4 states. There are 4 states that have actually passed legislation that say harm to the fetus is homicide, and they will be prosecuting with it and sending them to prison.
We have a question over here.
I think you can repeat it. Have you presented to any religious groups with presentation?
No, you guys are first. Oh, have we presented this to religious groups? No, not yet. Nancy asked us last month to do this, so we did it.
So follow-up question is, what do you find the biggest barricade to you from anti-abortion? I mean, excuse me, anti-abortion people. What, besides the second-class citizen, what is their argument?
Oh, their argument is to protect the life of the fetus. That's it.
For rape, to address rape, incest, and.
Pardon me?
So it really has waited now. It has changed.
Yeah. Yeah, and you have to what organizations do is they push things called heartbeat laws. And they claim that at 6 weeks there's a heart, and so it's a living thing, and so you have to protect it. And that's not true. What there is that there's flow of fluid in it's not even quite a fetus at that point. And a heart doesn't really show up. I think it's 10 or 12 weeks when there's a heart. So it's a different thing. But there is noise because there's fluid.
Okay.
But it's a.
Ellen, your time is up.
I'm done. Thank you. I appreciate your time.
Those will be guests.
Alan and Voki are going to be our guests on Citizen 411. That will be the May, when I not look at the dates. We're always ahead, so I have to think about it. So they'll be our guests on Citizen 411. The first Wednesday, May 12, but they're archived, so if you don't get to listen to it at 12. The XRW 99.5. So anyway, we're looking forward to having them. Thank you, Alan and Voki. Thank you again. Let's do a round of applause. Since I have the mic, I do have to add my 2 cents. When I have conversations about this topic with people, I always come back to what is the cause of abortion? If you are so anti-abortion, what is the cause? What is the root cause of abortion? Anybody? An unwanted pregnancy. That's the root cause. So why don't you work towards getting rid of unwanted pregnancy? And how do you do that? Education, birth control. Yes, exactly. So, yeah. There is a new agenda. I don't know if you have heard, like Lauren Bober from Colorado. She was pregnant with out of wedlock with her first child at 18. And now her daughter is pregnant at 18. So she's going to be a grandmother at 36. She was bragging and saying that this is a good thing, that rural, especially rural, white teenagers becoming pregnant at a young age was laudable. And she made comments like this in Congress. This is a whole new thing. I don't remember what they call it. There's a name for it, but it's people who are saying specifically white teenagers having children is a good thing because it's all about that white supremacist replacement theory stuff. And that's what that's about. And Trump, in his speech at CPAC, was talking about paying white girls to have babies. This is right out of the Nazi playbook. When they had young women, Nazi, like white German girls, having babies in order to promote more Nazi citizens. This is really weird stuff, you guys. This is really strange stuff. Thank you, Mimi. And it is important for us to be aware of all these different forces. So appreciate all the comments. That's a heavy subject. Okay, moving on. Irene Finley is our league's representative on the state league's effort in redistricting. So you know that every 10 years we go through the census process and the state goes through a redistricting process. And our league was pretty involved in that. We had to speak up schools, we had redistricting methods with our local county districts. And the state redistricting process, while it is a group of 5 people of 2 R's, 2 Dems, and a nonpartisan individual, there were some glitches this year, or back in 2020. And so Allison McCaffrey with the State of Washington League is leading an effort to, multi-year effort to make our redistricting process and the board that oversees it totally nonpartisan, and to correct some of the ills and missteps of this last session. And Irene is the representative from our league on that group, and she has a presentation on us a little bit to tell us what's going on.
Is there any?
I know this probably has to be a federal women voters issue, study issue, but is there any study going on in relation to redistricting in the state of Washington to repealing the 1920 federal law that blocked further that stopped the redistricting process in such a way that we couldn't have any more new representatives in Congress? Right now we have 765,000 people per representative in Congress. In 1920, we had 102,000 people for every representative. So we're 7 times more, 7.5 times more. Okay, that would be it. You want to come up? I mean, did that come up?
But if the camera this way, I can talk from here and they can see me in this.
Okay, that's fine. And then if you can address her question, if you don't have an answer, give it to Allison.
I don't have an answer, so I'm gonna find out. Thanks for giving me time. Thanks for giving me time on your agenda today. I started out with the league participating in Speak Up Schools that way. And then I got involved with Allison's listening sessions. And I took that information and tried to figure out how to map based on the preferences of the members in Southwest Washington. So I did some draft maps, mostly to show that yes, indeed, the voices of Southwest Washington could be incorporated in a statewide map. That led into testifying with the redistricting commission, and I submitted a few maps myself. I talked directly with staff of the commission and with staff at Dave's redistricting maps. That led into getting involved with Allison's task force. And that's why I'm here today. I'm looking for a few people to join me on the committee to collaborate with the statewide review task force. As some of you, maybe all of you know, the goal of the task force is to have a state constitutional amendment to make our redistricting commission truly independent. It is not independent now. We have the two supposedly major political parties each provide 2 commissioners. So there's 4 commissioners who vote on one non-voting chair. That means for the commissioners to approve a map, 3 of the 4 have to agree to it. And we need to do that within the deadline, not by law. So what happens is if they're not able to meet that requirement, then the state Supreme Court makes the decision. What I learned through the process in 2021 is that that whole process was flawed, and many of you were there to see this also. Yes, it's true that the census was delayed, and that pushed their deadlines forward. It's true that COVID got in the way, and then all the meetings were by Zoom, which resulted in a not good feedback system. But what I experienced was early on, the first few meetings, the commissioners were there in person, you could see their faces, there was some interaction. Then they stopped doing that. All these people testified, they spent a lot of time on that, and even they turned their videos on. You couldn't see them, you didn't know if they were listening. So that was a disadvantage. And then, right close up to the, you may know this better than I, to the deadline, they subgrouped. The 2 Republicans and the 2 Democrats went off, had meetings alone while they were trying to figure out how to agree to the minutes. And some people saw that as a violation of the public meeting expectation. Then minutes before the deadline, they voted and approved a map. But they didn't have a map to present because their software had failed. And so there is some question about whether or not they met the deadline. Is this correct, Jen? Yeah. So then it didn't allow for the public to give input to the final maps, to view the final maps. The nonpartisan, I guess the non-voting chair quit. And then it went to the Supreme Court to decide whether or not they had met their deadline. And the Supreme Court decided that they had substantially met the requirement of the statute, so the maps stood. That's the process problem. The systemic problem is that Washington State doesn't require you to say what political party you're part of. You don't have to say I'm a Democrat or a Republican. But the commission is supposedly the 2 major political parties. And I remember in my meeting, the first or second meeting of secret schools, Alan said, I don't think there are 2 major parties in the state. Yes, he's right. I read a poll from United America in 2018, and it was published by Washington Wire. Of 1.8 million voters in 2018, 43% were independent, 33% were Democratic, and 24% were Republican, identified themselves. In that same year, 2018, there was a poll asking people if they would vote for a Democratic candidate for the legislature. 75% said they would. 69% of those were Republicans, 76% were Democrats, and 85% who were polled were independent. That shows me that there's a lot of flexibility in this state for who can get elected. And the current commission doesn't reflect that percentage of independent voters. The other thing is many people who testified said that they were concerned about their community of interest. They wanted to keep their communities together and not have them separated by artificial political lines. Communities of interest is not a requirement. It's one criteria that can be considered. So what the task force can do is promote discussion, encourage legislation, try to have a truly independent commission, and to prioritize those criteria so that communities of interest might be higher in the hierarchy than it is right now. I'd like to show you what on the screen is the task force strategic.
Hold on, Irene.
First one is to build coalitions, partnerships, get people involved. Again, that's why I'm interested in getting a committee together for Southwest Washington. Then they'll have seek out getting information out based on who we can get to be involved with us, pass the legislation, and then have some kind of a watchdog to monitor the process. I would say it's obvious to me that the process was not well monitored this time, and I could see why they see a need for that going forward. But right now, all we need is to get some folks together to agree to help at the early stages, building coalitions, finding out who we need to get involved. And they want to do an initial survey to find out what people know now, get a baseline, and over time, check that baseline again to see what places we need to make changes or fill the gaps. So that's what we're looking at in the near term. I think it's the right time to do this. It might seem like it's a long way off, but it's not. So first we got to get something on the legislative agenda. Allison is not thinking that's going to pass the first time out. We may not have enough interest. It's not a very sensitive topic. But it might go to a second round, and then it has to go to the vote of the people in order to make this next redistricting cycle. So we need to get going on it right now. I think we have the right people at the table with the support of the league under Allison McCaffrey's leadership. I actually think we can do this, or I wouldn't be here. So thanks for your time. If you're interested, Sherry, can you put my email up? You can email me or see me after this meeting if you want to join me in the committee. I don't know how much time there is on the agenda if there's any questions.
Are there any,
Oh, sorry. I don't know that she can. My email is my last name, F as in Frank, INLEY, .m as in Mary, Irene,
there's another,
Irene at gmail.com. Finley.m.irene at gmail.com.
And I saw a couple hands.
hold on.
Any thoughts about some of our local redistricting, because the Clark County Council redistricting was last time?
Any thoughts not for me? Do you have any?
Yeah, the legal advice they got from the county council was a little iffy, but I think the charter needs to be updated before that, and that might take care of it. But I think also holding the county accountable, they really, you know,
Anyone else?
Well, I had a question for you. You were talking about, now wait for the mic.
You were talking about communities of interest in keeping those together, but isn't the point just to, because that sounds to me like gerrymandering, where that's what, yeah. So I mean, it's like, it should just be by population and not allow for gerrymandering, and that would kind of do away with the whole, you know, are you a Democrat, are you a Republican, are you an independent? Having said that, I don't like that we don't legislate parties.
I heard that during the redistricting task force meetings. I think that there are a variety of criteria, and the criteria together, the idea is to correct gerrymandering. I think it's important for the people to decide which ones are the ones that are not required they want to support. Does that help?
Yeah.
Yeah, it feels like it.
So one of the primary reasons that communities of interest want to be considered is that in the prior redistricting, the original map drew a line right through the middle of the Yakima Indian Reservation and divided them into two districts and diluted their voice in Congress. And the same thing happened, I can't remember the name of the Indian nation up near Spokane, but exactly the same thing happened there. And so communities of interest have reasons for being communities of interest, and have reasons for wanting to be together. And it's not necessarily gerrymandering, and sometimes these divisions are deliberate to dilute the effect of communities of interest.
I think Ellie had her hand up.
That there is one remaining legal suit at the state Supreme Court level, and it does regard LD 15, the Yakima. So that's likely going to be heard in June. But there's a similar type of case at the U.S. Supreme Court that's also supposed to be heard in June, same issues. So I think it's possible the Washington State one may be delayed a little bit longer because they want to see what the U.S. Supreme Court decides. Anything from the gallery? No?
Nope,
Okay.
nothing on
Thanks a
Zoom.
lot for your time. See you afterwards. If you want to be on that.
Thank you very much, Irene. We appreciate your efforts very much. And yes, as Jackie mentioned, redistricting is kind of near and dear to our hearts here because it was so messy with the county, so messy. And we are hoping that the next charter review group will be able to fix the wording in our charter. We are approaching our annual meeting, and our annual meeting in May is May 20th. And with that comes the election of our officers and board members. And we have a few members from the nominating committee, if they would like to share a few words on this.
I'll do that.
Okay, everybody, amongst some of my other committees, I volunteered to be on the nominating committee with Meg. Meg, would you please stand up? I gotta use the mic? Okay. And Ellie? Judy Stanton? Oh no, Jane Johnson. Sorry, that must be a different committee. Budget committee. And myself. And so far, we've had pretty good luck. I can't remember all of the folks that have agreed to serve again. But I've agreed to run for president. Marlene Meyer, if I'm pronouncing your name right, has agreed to run as treasurer. Hi, Marlene. And she and I are in talks. And we also have one person who I won't mention, who is interested, pondering being secretary. So that means we have some board of directors that we need. One, Ellie, one for a 2-year, one elected board member. We have to have a minimum of 3 elected board members, according to the bylaws.
There's 6 total, but we staggered.
That's for appointed. No, the bylaws, I was in there this morning.
There's staggered terms.
There's staggered terms for 6 elected, and there are 1-year.
Well, we'll have to talk, because I was in the bylaws this morning. And I copied and pasted from the May 2022 version. A minimum of 3 elected, maximum 6 elected. Appointed is a minimum of 3 and a maximum of 6.
But we have staggered.
Right, staggered is the appointments.
No, staggered is the elect.
Okay, see, we all need to read the bylaws, and I'm looking forward to somebody showing me that I'm wrong. Because I could have been in the old bylaws if possible. Anyway, so what are the tasks when you're on the board? You know, it can seem kind of, crazy. What are we talking about? So one of the first things you do when you're on the board is we have an Unell board meeting. So right after the annual membership meeting, we all get together and have a party. And we talk about what is 2023, 2024 going to look like. And we discuss, so we have board meetings. They run typically now 1.5 to 2 hours every month. You have to review some stuff like the treasurer report and the meeting minutes before that. And then you have to come to these kind of meetings every month, membership meetings, and so we like you to come to those. And then we have an August picnic. Who doesn't like a picnic, right? Bill, you were there last year, right?
I believe I was.
And we're gonna have one again this year. We're same place, different facility. Meg has reserved it in the Heron. And then we have a holiday party, lots of parties. And then in January, we do it all again, get another nominating committee, get a budget committee, figure out how we want to spend the money, have an annual meeting. So that's what the board of directors is. Our goal is to keep all you people having fun and partying and memory and educating voters, empowering voters, all of that good stuff. Okay? So if you're interested in being on the board, which is an amazing experience, because the most functional nonprofit board that I've ever served on is the League of Women Voters of Clark County. Thank you, Sharon. Yes, we do have a lot of parties, but I do have to tell you that sometimes the board slaps you down because I did put in a request for the Observer Corps to go to the beach. They said no.
That's not true.
The August picnic's gonna be at Vancouver Lake. Yeah, I stand corrected. They did say yes, you can have a beach trip at Vancouver Lake.
Kathy has to leave.
Okay, all right. Okay, that leads me to a few announcements. Our April meeting date will be the 15th. And we are adjusting that because of Easter weekend. Our guest speaker is going to be someone who is very active with energizing young voters, and she's from the East Coast, right?
Yes, Pat Supley.
Pat, we learned about the energizing young voters. Some of our members, I think Aaron Schick, might have been somebody else, goes to the League of Women Voters of Washington Voter Services meeting. And we learned about, a program that started in a small local league in New Jersey and got started and now is a national. They have their own website and Pat Suppley is their director. And they, during a time of COVID, managed to get into these schools. They managed to get their toehold in the door. And now and it's been a very successful effort. So on April 15th, she's gonna come and tell us her amazing story. And I hope you'll be there. Okay, also in April, on April 10th, so that's a Monday night, the state board is meeting here in Vancouver for the state board meeting. We will know tomorrow whether it's going to be at the Cascade Park Library or not. And Susan Fleming will be able to get back to me tomorrow night about that. If so, then that's where we will have our reception with the state board. All members are invited. They would like to have everyone there. We will do some sort of food that has to be worked out whether we're going to bring food or not. So that will be April 10th. It'll definitely be after 3. We're just not sure if it's going to be at 4 or it's going to be at 7. So we will get details out to you, but please put the 10th on your calendar. Looking forward to that. Again, the annual meeting is the 20th of May. And so that's a pretty big deal. And we have a guest speaker, Dr. Jim Conta, who is going to speak on alternative fuels. And he testified in front of the Washington State Legislature this year. So very energetic. We're looking forward to his presentation. As again, about the aprons, if you'd like to purchase one, talk to us. CDM, we get the use of this building for free. Okay. They have accommodated us with storage in the storage room and also with a file cabinet of our own. There are very few restrictions that they have given it. We are very, very fortunate. We are a nonprofit group and we have a wonderful space to meet in that we don't have to pay for. We have put this call out before, but we encourage you to consider either a donation to CDM or CDM can always use art supplies, craft supplies. A week and a half ago, they had a donor appreciation night and they showcased the artwork by the clients from their daycare, adult daycare, and the art was incredible. And they had many of the artists present. It was just amazing what they are able to do with a lot of these people who may have some cognitive, definitely some physical disabilities, and it was just so moving. So, but they can always use buttons, beads, shells, craft paper, ribbon, anything that has to do with craft. One of our league members just gave a bag full of Easter and St. Patrick's Day items for bingo prize because they play bingo. So I would just like to, if you would just remember CDM in the back of your mind, we need to show them some appreciation for them letting us use this facility.
For many years, my husband and I RV'd, and I actually collected a lot of rocks, a lot of where I shouldn't have. Did you mention rocks at all?
They will be wrong.
Okay, they come in all sizes. Yeah. Oh, great.
The smaller ones probably better because they will make pictures out of the rocks and beads. Okay. Yeah, you can bring it here. You can give it to me, whatever. Yeah.
really fine.
Office hours, they're here during office hours.
Nancy, I was just going to encourage you, since we have pretty good attendance today, but not all members, could you put out an email stating that to all of the membership?
It has been in the voter. We put it in the voter a couple times. You do get emails from me. I try to keep that limited so that if you get an email from the League of Women Voters that you know, oh, this is probably really important. I need to pay attention to this. I know we don't always, but anyhow, that's the goal. I'm just thinking that maybe one of the things we should do is treat this perhaps as a shower for PDM and choose the dates or 2 dates during the course of the year and invite members to bring items that are appropriate for use for crafts and so forth. And I think when people are coming someplace and they know that they can bring something to help, that they're sometimes more likely to do that. That's a good suggestion. Yeah, that's a good suggestion, and I'm happy to have someone lead that on. Okay. Oh, okay, we're going to hear from Deanne and Jackie. So Deanne, if you want to talk a bit about the tribes, and then Jackie's going to talk to us about land use and comp plan. Okay. No, I was hoping Sharon was still going to be at the computer. Nancy noted that we try to limit, I'm thinking I'm communications team chair. We try to limit the communications to you all by email because we know everybody is inundated by email and they're tired of getting emails. So we have 2 blogs on the website, the League of Women Voters website, that we're hoping you will consider subscribing to, where you get information in real time about developing issues. And I'm hoping you'll take us to the League website to show people how you can subscribe to these 2 blogs. Then you're going to log in on your League website. Are you logged in?
It's thinking.
Oh, it's thinking, okay. So you can see there's LWVCC News and then another blog that is just for the comprehensive plan update. Could you first take us to LWVCC News? This is where you'll get, boy, it has it both in there, doesn't it? So click on the top one where it says.
Well, I clicked on this one.
It's not showing up for.
Why is the news?
It's only, click a little bit, go scroll up so we can see what's at the bottom.
Well, you do have to.
No, I'm not doing that right now. Scroll all the way to the bottom.
The other scroll bar. Oh,
Okay,
this.
right there, yeah. Okay, these are both merged. We have 2 blogs. One is just called the LWVCC News, and you can take us to that one now, and click on, scroll up again.
You have to go into a news article.
Okay, that's one way to do it. That will take you to the blog, and you can subscribe. See right there where it says subscribe.
Oh, you can tell I'm not subscribed to the comp plan yet.
That's right. Now she is. With that easy, she subscribed to the comp plan.
I'm subscribed to the other
You
one.
should all do that. Then the other one is take us to the LWVCC News, please.
Well, we're gonna probably
Now scroll down, and this is where it's a little. There it is. See the top one, any of those under a quick look at planning for growth. Would you click on that one for us? Okay, that is our general
lead news blog. Okay, Judy and I have to work that out. It's a little bit confusing. You can subscribe to that too. So you're not getting constantly inundated, but this is where the blogs are. You'll get an email when you're notified to be notified that there's a new post on here. And we're really trying to get people to recognize that we're doing short little blurbs, respecting the fact that people are pressed for time. And we really do try to get the key points out there and keep you informed about important issues. And then Nancy asked me if I wanted to talk about our new try. While you're on the website, Sharon, could you go to the main page, please? And you can see there's a link that says, you can link there. This print now, I think, about the try.
Is it on the public site?
Public site, I'm sorry. The home.
I'm on home member only.
Okay, go to the public site, please.
The only way to get to the public site is you gotta log out.
And the try is also uploaded.
You can print it from here.
Yeah, you can print the try. We do have a few copies. Right now, Mimi and John know who's got copies. We're looking to kind of do a little more aggressive push on the tries, and we're looking to reprint with 2,000 copies. We found out that Vancouver Public Schools will distribute about 1,000 of them for us through their schools. And we're looking at battleground schools will upload and also put this electronically on their communications. So we're trying to get it out a little more. If you are interested in helping with the distribution further, please let me know. And my email is D, just the initial D, F as in Frank, INKEN @comcast.net. So we got additional money from the board. We're looking to use the try as a vehicle for promoting the league. And it's a very useful document. It has all the contact information for elected officials. Although I think it was pointed out to me that we don't have the cemetery board commissioner. So, okay. Thank you.
At present, we have just a few left. Do you still want them stored here at PDM? Pardon?
I'll work with Mimi and John.
And
There's
I'll take those.
about 100.
I need them for the voter services tabs.
And I have 30 years.
So that's about it.
Until the new order.
Are you aware of the misspelling on the front page? Okay, all right.
Actually, it's unbelievable to me, but since we did the first design, 6 offices have changed in the county. We have, I think, Woodland, Washougal, the center. So I'm gonna make.
Yeah. For those online, since the tries were first printed, there have been 6 elected official changes. So we will reflect those changes in the new ones that are being printed. Anything further on that? Okay. Jackie put together this wonderful recap of what's going on with the comp plan. And if you are interested in getting the special emails on the comp plan update, we have about 20 individuals who let me know that was an area they were really interested in. And so that's who I've been sending the information to. And we have a community-wide effort that is started that's so exciting, and Jackie's going to talk about that.
Thanks. Hi, everybody. So you may know I'm a little bit of land nut.
So comp planning, the county and cities are now in the process of doing comp planning. They have to be done by mid-2025. Sounds like a long time. It's not. And these plans will define where and how growth happens here over the next 20 years. I guess what I could do is put this in, make a blog out of this so people can have access to the links that I've got here. The vacant buildable lands model is complete. That model says how much land within the current urban growth boundaries is buildable. So that's how many people they think they can accommodate within the current boundaries. They're going to get a set of numbers from the state soon. And there'll be a low, medium, and high population growth estimate. They will take those numbers, the VBLN, and that'll tell the county whether they need to blow up everybody's urban growth boundaries or not. At least 3 cities don't want their growth boundaries increased. Vancouver, South Ground, and Mitchell, I believe. Although I'm hearing 2 of those on rumor, I'm certain about it for Vancouver. Appreciate it. Like I said, the other 2 are rumors, but I've seen some writing that says Vancouver does not want it. The public participation plan is in progress. There's a hearing in the county on March 21st at 6 p.m. The estimates that they're going to select are supposed to select at an April 18th, 6 p.m. council meeting. So those are 2 really important meetings coming up: public participation and what population numbers they're going to use. The middle number provided by the state has traditionally been within 1%, correct? And our current population is still not as big as was used in the prior urban growth boundary increases. So we don't think we need to expand urban growth boundaries. We'll see. I've got there's some state legislation that we hope passes. One mitigates the effects of climate change, another increases housing options for middle housing, and another is transit-oriented development. And I've got these numbers on the paper, and I'll put this in the blog as well. But one of the really exciting things is a woman reached out to us who wants to work on getting the community, the people who are not usually engaged in this comp planning process. And her name is Carissa Ostrom. She's got a Facebook page campaign for People's Park County. They reached out to the league. I know they reached out to me at Frederick Park County, and she's reaching out to other organizations to try to see how do we get younger people and less advantaged people and people who are all old, white, retired people. Sorry about that.
Older.
So they are meeting Tuesday to work on their mission and vision, and then we will be working with them. Hopefully it's a group we can partner with to help get education word out, get people engaged, and get people going and inspired up about this, because this really will make a huge difference. One of the things that I didn't really think about urban growth boundaries, but when the county expands an urban growth boundary, that land is controlled from a zoning and development perspective by the county until and unless it is enacted. So you have areas that will never be enacted by Vancouver. Think Hazeldale. Think up past 179th Street is in the Vancouver urban growth boundary is bigger than Vancouver. If you look at a map, it's insane. So it's really important where the boundaries are and how they're managed and how they're controlled. There are a lot of other related things going on with the freight rail development uses, which is there's a freight rail going through, from Vancouver up to Chalachi, and they want to develop along that, and how that happens matters to a lot of people. There recently was a lot of concern about a concrete plant that wanted to go in central Vancouver, and was using that freight rail as justification for upzoning that to that kind of thing. It's on hold right now. Not the county didn't do this. Knife River, the owner, decided to look for more appropriate location. But these land use issues are huge and really, really important. I'm really excited to see some of the young people
Jackie,
getting involved.
could you turn sideways? They don't want to see your back.
Well, anyway, I'm really excited that there's a lot of different groups wanting to get involved, or, you know, obviously along this department, we can hopefully get in. Yeah.
To what extent are density issues included in expanding urban growth boundaries? Or are they looking primarily for single occupancy, single family occupancy?
Good question. So the county has just finished a housing option study that is focused on the Vancouver urban growth boundary, but also is looking at density, about making more affordable housing available. It'll be interesting to see how that plays out. I've been in some meetings, we've been talking about how to do development code and zoning for duplexes, triplexes, fourplexes, cottage housing, cluster development, different things like that. So they are looking at that. The state, one of these state legislative bills they're looking at is requiring that they allow more dense housing in places that are zoned single family homes.
Is that the initiative?
I couldn't tell you, but it is middle housing. And so we'll see, I think some of our people voted against it, but some of them have voted for it. So, you know, I have the bill numbers in this and we'll get that available to everybody. So we'll see. The county has tended to lean really heavily towards allowing single family. They've got this belief that everybody wants to live in a single family home. Whether everybody wants to or not, those big single family homes aren't necessarily going to people who live in Clark County. They're going to people moving up here from Oregon and California. I mean, who can afford some of these places? So it is important to get that middle housing in. Transit oriented development is another thing, allowing more dense housing near transit. So, you know, the transportation plan that goes along with the growth management act is really important. I've got a bunch of really cool links in this document too, for people who want to learn a little bit more about what comp planning and BMA is. So I don't want to take too much time for this today, but it's an exciting topic and a really important one.
Thank you, Jackie. I totally agree that I knew nothing and I met Jackie and it's been a wonderful education ever since. And I greatly appreciate being exposed to the things that we need to pay attention to in our county. And one thing to keep in mind with the comp plan update, we are not planning for us. We are planning for children, grandchildren, great-grandchildren. We're not the ones who are going to have to pay for the additional infrastructure. We're not the ones whose taxes are going to be impacted. And I think that that's something that, I mean, that's the emphasis of mine when we're talking about this, to remind people that there is a cost. There is a huge cost to growth, and it's not just financial. Janet Hedgepath is so wonderful at pointing out all the health, the environment, all the other costs that are involved and things we need to keep in mind when we're planning growth. So it's very, very important. So thank you. And we will get the Facebook page to you. It's just forming on this People for Clark County. Just got notification of it last night. So we'll get that to you, Deanne, as soon as it's official. So yeah. Well, the other lady, I couldn't help it. The bill to kill advisory votes is still alive and well.
Yes.
And the middle housing bill is alive. So that's a lot. One last thought, how many of you subscribe to the Washington State League of Women Voters legislative update? Okay, great. That is you do have to go to the state website, you do have to subscribe to it. Because they're like us, they don't want to send stuff out willy-nilly if you are not interested. But if you want to get updates every Sunday night or Monday morning on what's going on in the present legislative session and which bills the league is supporting, that is a marvelous, effective tool. Also, Fixed Democracy First does they're partners of the League of Women Voters, their Monday morning
report, legislative report, is also extremely excellent. So if you're interested in following into that, Washington State Legal Women Voters legislative newsletter, subscribe to that. Any other comments, thoughts, questions, good of the order? Alan.
So again, thank you to all of you for your kind patience. As I mentioned, Voki and I publish a daily action newsletter on healthcare. If you want to give me your email, I'll make sure you get it. Or I'll tell you my email. It's AlanUnell@gmail. AlanUnell, just my name, @gmail.com. Thank you.
Thank you. All right, get those tries out. Have a wonderful St. Patrick's Day. And we will see you back in
April.
April 10th, meeting, reception with the state board, of which you'll get information. Anything further? Okay, thank you all, and we just need to have about 4 chairs per table. Just make sure we leave the building the way we found it. Thanks so much.
Bye, Teresa. Hold on.
I put it on the